The City of Johannesburg and its social welfare partners have been trying to accommodate affected families of the Marshalltown building fire. 3 sites have been identified, and our reporter Katleho Sekhotho is at a community center in Bezuidenhout Valley where some of the victims are accommodated. All right. Good evening, and thank you so much for joining us. I mean, you're still at the center then. We're seeing that many of those that are being accommodated are quite wary of being at the shelter. How are those that have agreed to join the shelter settling in?
Indeed, Katleho, the victims are about 150 here at the Bez Valley shelter, settling in for the night. They've had their evening meals, and it's women, children and men. They have a place to sleep at least for the night and for the coming weeks. We know they've been left stranded due to that fire, and a lot of trauma here because some of them have actually lost their loved ones. Now, I just want to show you, Katleho, behind me, many settling in for the night. They were able to get clothing. If you see there in the back, they were able to get clothing that was donated by members of the public, and they were able to also find shoes and check if any of the shoes fit them. And so, yes, it's a lot of coordination from social development, working with NGOs, as well as, just working together to at least have people settle in. People have been given blankets that they can take with them individually, which they can sleep with and at least keep warm in the coming nights. So, a lot of activity here as they are getting into the evening. So it's on one hand you see people being given food and shelter and at least something to drink, but the biggest trauma here is that so many of them are in pain, psychologically, emotionally, and that counseling and care looks like it is being provided. But I just want to bring into the conversation here Lillian from the South African Women in Construction organization. Lillian, thank you so much for your time.
My pleasure.
Thank you. Thank you, Lillian. What are you doing here, and how are you helping these victims?
We are here as South African Women in Construction, collaborating with Mangweta Foundation, which is the main foundation that is always here assisting the community. So we are working out together on how to see how we can make this possible, assisting all the people who need to sleep here, which are like 150 or so. Yes, we have sponsorships that came, and then we had to put on the blankets for them and make sure that they have food, of which that we did, and then we also made a room for them for the healthcare, and then as well as some rooms for the counseling, because they need counseling. We also receive some who are coming from the health sector, and they need to be dressed out and cleaned out, and to provide a comfortable accommodation for those who are sick, who are affected, who's been injured. That's what we are doing. Yes.
And Lillian, in terms of the work you're doing and what you're seeing here, obviously people are coming in feeling differently in different ways. What's the biggest challenge you've identified here?
They are traumatized. They are injured. They have survived. I just spoke to the other one now, who is he's a young man of early 20s holding a baby of 2 years, and the wife passed on. So it's a critical experience. It's very, very touchy, and it just needs a divine attention that, we really need people. I have seen a woman who is very big, on maybe size 50. She fell with her head, and she's not okay. Her head is affected. You can see the bruises. The situation is actually not. It's not okay. We've got counseling room that is dealing with those traumatized. Every now and then they were cancelled, but again that thing comes back to them again, and then they get attention. We've got the nurses here who are assisting them. We are trying by all means to, just to keep them happy and relieved, to to give them a home. Yes.
And Lillian, lastly, what do you see being a solution here permanently? Obviously, people can't live here permanently. I understand that this is a temporary solution. What do you see happening going forward?
Our wish is to see maybe if the government can provide a permanent home for them, whether it's a refugee camp like that, as long as they can have a home. We had to deal with people who don't have documents and they're running away, yet they are injured, So if they can be given a proper home, because these are the offices, is not a permanent home. We've got kids who are going to school, they have nothing with them. We've got people who are sick, who have a chronic sickness, others they need ARVs, they left them, they don't have, they have to drink, they are sick, they are breastfeeding, and they don't have. So yeah, if they can have a permanent home and the health care, we really need a agent medical facility to be here.
Yeah. And just what you've said there in terms of the injured. Yes. I know so many people were taken to hospitals, but it looks like some people fell through the cracks in terms of getting medical care. Do you know why that happened?
They fell from the floor, others they fell from the third floor, whatever floor they are. Others are bent, their skin is still peeling off, of which the sister was dressing, we were helping them to be dressed up again, yes.
Yeah, I mean, do they not need to be taken to hospital, maybe some who are here who are not okay?
They were treated. Okay. Yeah, they were treated. We've got nurses who were treating them from somewhere, and they came here. They took them. They came here, but even here it's not enough because they don't have medication. They were treated, and they don't have medication to take. They're still in pain. Yeah.
Okay. Thank you, Lillian, for that.
It's my pleasure.
Thank you
for having me.
Thank you. Katleho, you heard it there from Lillian Mehlomakulu from the South African Women in Construction, just explaining how they're helping here, really helping in terms of service and getting people within her organization just to help logistically organize, give people blankets, at least assist with handing out of the food, setting up a facility where people can be given medical health care. And so an intervention by a number of NGOs here just to assist the survivors really of this fire, at least find some footing since the incident.
All right, Katleho, thank you so much for that update. We really do appreciate it. It's very sad times that we're living in the city of Johannesburg.